I wanted to chat about some things that I'm seeing circulating on social media with comparisons between the 1918 pandemic and the current pandemic. And I feel like maybe these are surfacing a little bit more right now because I believe the US has surpassed its death toll from COVID compared to what its death toll was from the 1918 flu. So I was just wondering if there was more to the comparison than just that. I mean, I feel like there are a lot of factors that go into comparing pandemics.
Yeah, I mean, you can compare the numbers, and certainly as the population was much smaller back then. So as a share of the population, that was a much more deadly pandemic. Fortunately, our modern hospitalization, I mean, many times more deadly on a per population basis. So in absolute terms, it's more, but in relative terms, the death rate is less because of modern medical care and hospitalization, and now the impact of vaccination. However, the variations in the way the pandemic has been managed across the country and the risk factors are very, very much like 1918. For example, we in 1918, the federal government, because we're in the middle of World War I and just coming to the end, and the president at that time was so focused on the war effort, and we had the sort of the censorship of war. The federal government had no involvement in the response. No federal resources were used in 1918, and the president never said anything about the pandemic. As a result of that, we had cities across the nation doing things differently. What we learned then from studies of hundreds of cities is that those cities that started sooner with more measures, staggering the trolleys, closing schools, avoiding big events, that started earlier with those, kept them in place longer, had half the pandemic death rate as those cities that were on and off with their measures, slow to start, fast to turn them off. So that was one learning. The other thing is there was a fourfold difference in the pandemic-related death rate among 400 cities. And half of that difference was attributable to three things: the pre-pandemic health status, measured by infant mortality, poverty, which was a lot today, then is now race-related, and air pollution, coal firing and all. And so those same sort of dynamics, we not so much air pollution, but the impact of the socioeconomic differences in death rates and of access to health care, just the same today as 100 years ago in terms of the impact on the unequal, disproportional impact on poor populations and populations that have not part of the healthcare system.
It's interesting you mentioned the precautionary measures taken back then and how that made a difference. And you said that they were like wildly different, much more different than what we are seeing. Because like today we are seeing, to some extent, a difference in how certain states are handling things.
Yes, that's the point. We haven't learned the lessons from 100 years ago in terms of the importance of being consistent and keeping measures in place until we've really got this thing under control.
A lot of the comparisons online I'm seeing are going, oh, look, look what they did back then and look what we're doing now. And it looks like the epi curves are the same. So like, why are we even bothering to do things like vaccination and locking down? Because it's just going to look like what they saw back then when there were like fewer, medical advances.
Yeah, I mean, this is a very different virus. And what people haven't come to grips with is that this virus, the Delta virus this year, is not the same virus we had last year from a functional point of view. it's easily 2 or 3 times as contagious, and it's eluding vaccination. The world was not anywhere near as connected 100 years ago. So we are infinitely more connected. We're more urbanized. We're multiples urbanized. I mean, we're 50, 60, 70% urbanized, which contributes to the spread. And we also have had have enough outbreaks in different places that we have the potential to keep generating new viruses. So we still don't understand this virus. Even the Delta is hitting much more consistently. We somehow managed not to suffer as much from the UK original Alpha that came through. Michigan was really badly hit, but this is a much more treacherous virus than the 1918 flu.
Something else that's just fascinating to me as well is the advent of social media, and I mean, that's one thing that sticks out to me as something that they didn't have to deal with back then.
Yeah. I mean, social media, and we talk about this in the End of Epidemics. Social media is a double-edged sword, because on the one hand, the misinformation, the deadly misinformation that gets propagated, and as Mark Twain said 150 years ago before social media, the lie gets halfway around the world before the truth has put its shoes on. And that's true. But on the other hand, what we do learn quickly from social media is what those unhealthy and sometimes fatal misbeliefs are, and we can work to correct them. And during the Ebola outbreak in the 2014-15 in West Africa, that had a big horror factor, wouldn't have gone global, but people used back then in West Africa, they use social media to clone their messages. And we can get, the good, solid public health messages out. So it is a double-edged sword, but we've got to fight really, really hard against the misinformation and the deadly misinformation.
Do you think people would be surprised to see images from back in 1918 of people, protesting masks and protesting certain protocols?
So there's a dynamic with pandemics that goes back centuries. Blame, conspiracy, misinformation. I mean, with that pandemic in 1918, the Spanish got blamed because they called it the Spanish flu, but that was only because they weren't censored, so they could talk about it. And each nationality blamed another nationality or another group. So that's always been there. And the propensity to rebel against controls. I mean, you can find stories throughout that pandemic of cities that rebelled, of particular religious groups that thought that didn't understand that modern medicine or any kind of public health is a gift of God and we should follow it. They opposed measures, and so that's a dynamic that happens when people are in a situation where there's fear and there's uncertainty. And so that dynamic is manifested differently, but it's the same human dynamic.
What would you like to see people learn about from history and apply to this current situation, so maybe we can get out of this better?
Yeah, well, I mean, I think we're slowly, and when the question came up a year ago about how we would about some of the responses and all, I mean, it was already clear that unfortunately there's a good chunk of the population who won't believe it until it's been their grandmother, their child, their newlywed spouse who succumbs, and then they believe it. So there's that part of it in how we respond here and now. But the bigger worry, I mean, we will get control of this virus. It's not in control yet. And anybody who thinks it's in control, all you got to do is look a few states over, or look across. There's no country that's safe from this. But we will get through it. Not as quickly as we could have, but we'll get through this. But we're entering a century of pandemics, with all the different risk factors that we've talked about. So what I hope is people will remember this moment. Remember what you've been through in the last 18 months. How many plans have been dashed, how many promises have been broken, how many weddings have been deferred, how many funerals you've been part of or heard of, how many friends and colleagues have lost jobs, how many kids have been knocked behind, and again, disproportionately, the poor lower income, poor populations in this country, to a large extent, people of color, who can't Zoom the way those with resources do. Remember the moment. Remember how disruptive it's been, and make sure that our leaders keep investing in the things that public health people and scientists know would make us far safer from future ones. These are not inevitable. Outbreaks are inevitable. The viruses are going to keep jumping into humans. That's inevitable. But what's not inevitable is the amount of death, destruction, economic upset, unemployment, and all sorts of social consequences, including knocking women's rights back at least a decade in terms of employment and other opportunities. I mean, that is not inevitable. So we need to remember this moment, and when it comes time to support budgets and to support action to make our country safer, our communities, our country and the world safer, support those and make sure that we hold our leaders accountable to doing the things we know are affordable, doable, and would make a huge difference.
Very good points. Very good points. One final question I wanted to ask. You kind of alluded to it earlier, but I just want to make sure that I have it. Your opinion clarified. People shouldn't expect this pandemic to kind of burn out and end the way that Spanish flu did or the 1918 flu did.
Not in today's world, and not with this virus. If we think we can sit back, yeah, it'll burn out, but it'll burn through so many more. The fuel of these viruses is previously uninfected people. And if we wait for everybody to get infected before we, for example, vaccinate the world, we're going to burn through a whole lot of human lives, which is the cost of that, not just in human terms, but in lives, but in economic terms, in terms of disrupted lives and livelihoods and futures. The cost of sitting back is just huge, and it'll catch up with all of us if we don't act to get vaccinated and do the things that we know will take this to the finish line quicker as a global pandemic. I mean, this virus will probably always be with us, but it will be with us at a lower manageable level. What we can't do is let it stay at a level where it overwhelms emergency rooms, crashes hospitals, exhausts and depletes our health system, and disrupts our global supply chains. I mean, that just is in no one's interest.